And welcome back. Well, 1 in 4 adults over 40 suffers from chronic pain. If you're among those who live with chronic pain, you know how debilitating it can be. Joining us live is Dr. Malone, a board-certified pain specialist who is also a chronic pain patient himself. Today he's here with some other treatment options outside of opioids. Good morning to you, doctor.
Good morning, Tiffany. Thank you for having me.
Absolutely. I think a lot of people watching hear chronic pain or just the word pain and they perk up and they say, that's me. I feel that way every single day. How do you describe chronic pain?
Chronic pain, Tiffany, is when we're talking about lifestyle limiting, severe chronic pain that limits someone from living a normal life. These people often can't work a normal work day. They can sometimes barely get out of bed. They can sometimes barely sit or stand for a few minutes at a time. They have a great deal of difficulty taking care of themselves and their families.
How is it often managed? Because we hear so much in the news about opioids and painkillers, things like that. Is that the main way that people are handling chronic pain?
Classically, Tiffany, it has been a very big part of pain management. We're trying to get away from this because of the obvious downfall of chronic opioid therapy. There's an increasing number of accidental overdoses and increasing number of addictions occurring. So we're all looking for answers. Fortunately, today we do have some answers. There's a new therapy in the field of spinal cord stimulation. Spinal cord stimulation has been around for a couple of decades, maybe a little more, but new advances just in the last 18 months or so from a company called Abbott. These technologies called BURST and DRG are especially effective in treating chronic pain. I can attest to that because I had chronic pain myself. I injured my back about 8 years ago in a heavy lifting accident. Completely destroyed a disc in my lower back. I underwent physical therapy. I was on chronic pain medicine, had spinal injections, even had 2 back surgeries which stabilized my spine but didn't help the pain at all. In fact, made the pain worse. I struggled with this for years, barely working part-time and taking care of my pain practice the best I could. Finally, about 18 months ago, Tiffany, new pain therapies from Abbott came out called BURST and DRG. The BURST technology is a waveform that simulates the natural language of the brain, and in an implant that we place in the low back that looks a little like a pacemaker, this BURST technology talks to the brain, telling it that there's no pain there. I've had great success with that in my patients. About 6 months ago, I had my own implant done with BURST, and today I'm pain-free.
That's incredible. So it's not delivering a medication, it's delivering a wavelength or an energy?
That's right. It's delivering a waveform that looks like a burst. There's a burst of signal and then a silence and then a burst signal, which is similar to the natural rhythm that the brain talks to itself in.
And now, is this only used in the spine? Because I know you specifically spoke about the spinal cord stimulation, the SCS therapy. Is this only used in that place? Can it be used for other types of chronic pain?
This is used almost always in the spine, but it can target almost any part of the body. It can target the arms and legs, the torso, of course the low back, the neck, even headache pain can respond to spinal stimulation.
That is incredible. I think people who are listening to this and they have a loved one or themselves who suffer every single day with this chronic pain are thinking, oh my gosh, I need to know more. What kind of questions do you ask your doctor to find out if A, we have that therapy here, and B, if you're a candidate for it?
Great question, Tiffany. First of all, ask your doctor to refer you to an interventional pain specialist. These are the doctors that are trained in this type of intervention. Ask your doctor if you would be a candidate for spinal stimulation. Ask your doctor if you can help me get off of chronic opioid therapy. And that's about it. If you can just get to a spinal specialist, an interventional specialist, everyone knows about the spinal stimulators today and the new technology from Abbott.
It's incredible. Dr. Malone, thank you. Can you just tell me in one word, since we're out of time, how your pain has changed?
Tiffany, my pain is basically gone, and I have struggled with it for 8 years.
Fantastic. Thanks so much for joining us today. I love it.
Thank you, Tiffany.
And the website to learn more, talk to your doctor first and foremost, but otherwise you can visit poweroveryourpain.com for more about Abbott's device.